have downed their tools for what they are terming as failure by the county government of Mombasa to address their grievances. The healthcare workers say they have not been paid their salaries and their deductions have not been forwarded to relevant authorities. The workers have vowed not to return to work until their issues are addressed, leaving patients stranded.
Speaking to the media, the healthcare workers, who include doctors, clinical officers, nurses and laboratory technicians, expressed their dissatisfaction in the manner in which the county government of Mombasa is handling matters pertaining health workers. They say the county has failed to honor previous agreements, leaving them with no option but to down their tools.
When you go to the county, I've been having meetings with them, they say they had other pressing issues. Now we are wondering what pressing issues are more pressing than our salaries.
They say their salaries have not been paid and their statutory deductions have not been submitted to the relevant authorities, which has plunged majority of them into financial crisis.
I want to say categorically that we have discussed so long on the issue and the subject of salaries, and we have set our bare minimum, and that is full payment of our January and February salaries and all the remittances that run from the month of October up to date. And therefore, the only language that we can understand, that we can listen to, is full payment of salaries and remittance.
As a result, medical services have been paralyzed in the county healthcare facilities, with the practitioners advising patients to visit hospitals in the neighboring counties for treatment. However, the county of Mombasa, through the acting county secretary and head of public service, Job Tumbo, has this evening urged all the county staff to continue rendering services to the public as they address any pending grievances.
We continue to urge all our staff to continue providing the critical services that we are mandated to do.
Meanwhile, their counterparts in Nairobi working under the national government have called on the Salaries and Remuneration Commission (SRC) to cease their intention to abolish job-related and labor market adjustment allowances payable to medical doctors, pharmacists, dentists and other healthcare workers in the public service.
We have 80 doctors who the money has been budgeted every year. The money is lying idle in the Ministry of Health. But SRC is very quick to write letters declining payment of that arrears to those doctors over now 5 years. But the action whereby they have now come with an axe to ensure that the salaries and the allowances cannot be paid to the persons that are in the public sector is not within the mandate.
The healthcare workers say the review of the allowances by CRC without involvement of bona fide stakeholders is against the Constitution. Patronila Goren for TV 47 in Mombasa County.